Well, hello, Cam followers. This is probably one of the weirdest Facebook Lives. I'm sat on a floor in a hotel in Atlanta, and Carrie's over there. She's over in Colorado. We're hoping that the internet's going to work wonderfully for this live. I've been waiting for a long time to talk to this lady. So apologies if there's a little bit of background noise. We're just making the best of the situation. Just to let you all know, I've been at the APM conference in Atlanta. It's a 2-day event called the Pain Management Forum. It's utterly fantastic. And I really, really do feel that all of you guys need to look up the International Veterinary Association of Pain Management. I'll put a link inside. If you're a vet tech, have anything to do with the canine professional world, something that you should know about because the website's incredible. Right, that's my plug done. Now, over to my amazing guest. Carrie, please tell people about yourself.
Oh, Hannah, thank you for having me. I'm so honored to sit here with you and just in awe of what you have developed with Cam, and to be able to get the word out and talk a little bit about arthritis. And our goal is to kind of differentiate between young and old. I've been a veterinarian physical therapist for 23 years. Got some changes coming down the pipe. I directed rehab for VCA Animal Hospitals for about another week, and stay tuned. I know exciting things coming down for the future, but looking to transition out of the clinic and to really, kind of take what I've learned from all of you, from clients, from patients for 23 years, and really try to figure this out. I've worked with our parent association, the American Physical Therapy Association, our animal rehab special interest group. I'm not a vet. I'm a physical therapist. I'm a human. My dumb joke.
Yeah.
So, to be able to work with Hannah, to be able to work with the veterinarians and to bring this collaborative practice together is a dream come true. So thank you again.
Absolutely. And I think what we'll do is we'll jump straight into talking about the title, about osteoarthritis being in the young and old. Let me just block someone who's just decided to start trying to block you as a good boy. We keep having people that kind of jump on board, and then they give people links to another place where then you have to pay to watch.
Terrible. Oh, geez. Oh, yeah. Wow.
But it's all good. So let's crack on.
That is over my head. Okay.
So I definitely started, Cam, with much more of the mindset that I needed to help the grey muscles. I needed to help the older generation. And that was like 10 years ago. I'd been in practice for like 10 years. And that was the predominant amount of dogs that I saw. That was the predominant population. But over the last 10 years especially, there's been a huge drift in our understanding towards it being a young dog disease. And that's a challenge that I really think that we need to communicate that to everybody involved, that actually this is a young dog disease that presents itself to our eyes, because we're the limiting factor. When people say to me, dogs hide pain, I'm like, no, we just don't see it. Or understand it. So kind of tell us all about your experiences with this young dog, old dog kind of concept and shift.
I love it. Just to discuss from the shift from the old to the young. I think when I first started in this field 23 years ago, it was the same thing. We focused on the geriatric population. Now they've actually divided dogs age from senior to geriatric because they are living so long, thanks to you guys, thanks to the veterinarians, thanks to the field of veterinary medicine. And now, we're trying to promote this, and I don't want this to come across the wrong way, that by the time they get the gray muzzle, it's too late. It's absolutely not. But what we want to encourage, as a human PT, movement is life. You have to move, period. Or you die, or you die. And that's with any mammalian species, or most species. So how do we break that cycle? Catch these guys early on. Catch them when they're puppies. Catch it, whether it's OFA, X-ray, MRI, CT, all of our advanced diagnostics are one thing. But to be able to physically put your hands on these young dogs, and even before a lameness happens, who's to say that we can't identify this even before the dog starts limping.
Yeah.
And to say, oh, look at the conformation of your German Shepherd compared to the conformation of your Labrador, Chihuahua, whatever you have, is this dog more predisposed to issues down the line?
Yeah.
And can we identify that earlier on? So we are seeing these guys live longer. We are identifying elbow dysplasia, which is horrific. I mean, any form of arthritis is tough stuff. But in by the time you guys see them and they come to us, the dog is typically lame. There's some issue why that owner has brought their dog to see the veterinarian.
Yeah.
So how do we break that cycle of, hey, my dog's now struggling to get up? Don't want to say it's too late. It's not too late. But what would have happened a year ago, 5 years ago, 10 years ago, had we gotten on board to develop some sort of a program to keep that dog moving and improve and maintain the mobility, maintain that range of motion, maintain that strength? There's so much we as physical therapists, rehabilitation practitioners can do if we break that cycle and catch these guys early.
Yeah. And I think about this all the time. I'm just going to do a couple of triggers, make people think, in that once you kind of get your head around arthritis, pain, euthanasia, leading cause of euthanasia, leading cause of suffering before euthanasia, it's a big problem. It's a big problem.
Yep.
And then you start bringing in the fact that everybody wants their dog to be with them for as long as possible. Our dogs, they're part of the family. So already you've got that huge drive to avoid that situation.
Yeah.
So the foundations are there to do something about it early.
Mm.
But then we have this problem where people, A, don't realize it's a younger dog disease, and they don't take the clinical signs seriously when they present themselves. A little bit of lameness, a change in behavior, a change in posture. Oh, it can't be that bad because dogs are amazing.
Yeah.
Dogs are amazing
Yep.
at getting on with things. I often say facetious things like, well, they don't know the NHS exists, so of course they're just going to get on with it. They've got no choice. They get on with it.
Right.
But what we do need to do is try and give people examples that identifying a problem early, yes, it's sad, but it's not a bad thing, because I'd rather identify it early and have the opportunity to do something about it than identify it late and feel that my options are gone. And what I find as a vet, when I have broached the subject in dogs age 1, 2, 3 years old, owners are upset really badly, aren't they? They're initially really shocked. It's like you've just punched them in the stomach. And they have a mixture of emotions of sadness, anger, frustration. But once you start working with them, there is almost a gratitude. At least they know and they can do something about it. But it is such a complex time and situation. You can see why clinicians find it really hard. You can see why owners don't believe. You can see why owners step away from the vets because they just don't want to know about it. Do you see what I mean? It's
Yeah.
it's very, very difficult.
Well, yeah, and because it is so complex, and I think you're right. Do you give them medication and send them home? And I think the other potential reason for that is it's super time consuming. And veterinarians are, in no fault of your own, you guys are seeing patients every 15 to 30 minutes and, running through, which is why I think even if it's just an initial consult with a physical therapist, with a rehab practitioner, is going to be super beneficial to help guide what these next steps are. And maybe you see them, maybe it's once a week for a few weeks, but it shouldn't continue. You shouldn't have to do this once a week for the rest of the dog's life.
No.
There's a guidance that we can help, at least to help you understand. Yeah. And the other big factor in this is the hands-on. Let's empower you as an owner.
Yes.
And don't be afraid to touch your dog. Don't be afraid. Oh, I'm going to hurt him. It's a lot like a dog coming out of surgery, and clients don't want to put their hands on them because, oh, I might hurt it, and it looks horrible, right? It looks like Frankenstein. You have that nice little suture material, and they're afraid they're going to injure their animal. So it's similar with arthritis, right? nobody wants to do anything to hurt their pet. But that's where coming in just once, just give us one chance to say, hey, I want you to feel this. I want you to feel what decreased elbow range of motion looks like. If you go too far, your pup's going to let you know, right? If I start to force overpressure and my elbow hurts, the dog's going to let you know. But let me help you identify what that feels like, what that looks like, what that pain response is all about. And let's feel, hey, put your hand right here, owner. I want you to feel how tight the spine, the muscles that run down the dog's spine. Just feel that. Go feel your puppy. Go feel, the two different puppies, even in the same litter. What is tight? What does that mean? What does that look like? Why is the dog's leg shaking?
So we believe the same thing, of educating owners at a really earlier point in the dog's life, maybe even socialization, puppy classes. So one of the things that we want to do is create a module about how dogs are likely to present pain now that we've got more information about young dog pain presentation, and give it to every dog trainer in the world, every socialization group in the world, and just say, look, in your 6-week course, 4-week course, whatever you're doing, plug this in. It's like a plug-in. And that's when an owner's going to be able to say, I'm equipped now to catch things early. But you, as you say, if only we could also teach them to have the confidence to palpate, to observe, to see. Yeah, that would be nuts.
It negates one thing, right? And that's typically when we can see something. It's visible. If there's a lameness, it's pretty darn obvious, right? But what about getting up off the floor? In order to gait, you got to be able to get up first. So what about identifying differences and potential differences that lead to pathology down the road? What if we can identify that before it becomes an issue? And to say, here's what it should be, here's what the range should be, and here's what it is. Or, just to be able to identify problems early before they become an issue. And that's where I think we can have one of the greatest impacts, within this field.
So because you're still working, you're still in practice at the moment for a week.
For about 9 more days.
9 more days. She's now available, everybody.
One
of the most amazing people in the world. When you look at your caseload, what kind of dissemination from young, middle-aged, and old are you working with where you are over in Colorado?
So by the time those young ones come to me, they've had OFA x-rays, right? They're coming because of a problem. They're coming because there's a forelimb lameness. They're coming because there's a hind limb lameness, which is a typical presentation. And those are the young guys. It's usually after the fact that the veterinarian goes through their paces. They identify where the arthritis is, and then they come to us for that initial consult. We can look at modalities. We do a lot of the hands-on to improve range of motion, improve flexibility. Of course, strength is an issue, but I can get on my soapbox about that.
I'll let you do that in a minute.
Okay, we'll get back to that. But this whole forced exercise, and if there's a problem with decreased range of motion at the hip, instead of going all the way out, now the dog shortens their stride because the hip hurts, and then they tuck their butt, right? So if we're forcing that to strengthen, which everybody wants to do with arthritis, right? Are we feeding into this self-perpetuating cycle of arthritis? Anyway, that's another little tangent and soapbox that I think there has to be a fine line. There's a happy medium there. And I'm not into forced exercise for that. So there.
Well, what we can do, we can include that, because I've got a couple of cases to talk about.
That's great. That'd be great.
Let's tackle the concept of disease, not disease, with old dogs. Let's talk about the key differences.
Okay.
So the people that have looked at the title, and they're probably a big population of owners that have got young dogs. So please, guys, there's 45 of you listening at the moment. Tell us what age your dog is and why you're listening. But what have you found with the differences between the young and old presentation? So Give me a classic presentation of a 1 to 3 year old, and give me a classic presentation of the 10 to 12 year old. So
Yeah.
to help people out.
Yep. So again, with the younger ones, it's typically a lameness, right? But and that's the usual reason why the dog comes to the veterinarian in the first place.
Yeah.
When I put my hands on that patient, there's almost always some sort of decreased range of motion, which which kind of comes along with muscle spasm or tightness, if you will,
Yeah.
and compensation. Almost always I can find if that dog, if it's a pelvic limb lameness, that dog is shifting forward. Now we're seeing some reduced range, maybe in shoulder extension, muscles in the back that are painful. I mean, to a
Yeah.
point where that dog's going to turn and be like, hey, you palpated that. That hurt. I can feel that. And
Yeah.
I equate it to, overuse. If you go and work out and you're sore and you're limping around, look how it changes your gait. You're
Yeah.
still going to move. And that's what that 1 to 3 year old dog is going to do. They're going to get up. They have to. They want to go run and play and go to the dog park and hike. So they'll hide it. And it's not as obvious to us. And that's where I feel like we as a profession are falling short to try to identify this early on. So what do? Lameness goes away. Maybe the dog is rested for a period of time, put on an NSAID, off we go, right? And we don't see those subtle changes, those subtle compensations till it becomes a problem. And now our dog's 10, 11, 12, turning into geriatric, they're losing muscle. It's all part of the aging process, right? We can't change that. But we are perpetuating this degradation of cartilage to that then causes fascial restrictions. So I encourage you to look at a young dog, look at an old dog. Just put your hands on their back, all over their body. Just move the skin. And some of these older dogs, you can barely move it. Versus the young dog, you can lift skin, you can pull it in 10 different directions. The older dog, they are so stiff. It causes fascial restrictions. It causes joint tightness. It causes even more significant reduced range of motion. And it's more obvious with transitions. The dogs don't want to jump anymore. I have some amazing videos of some of these older guys that when they go to sit down, there's no eccentric control. Their butt just goes bam, right down on the ground. And then they do this little shuffle to try to lower themselves onto the ground.
Yeah.
And where is that coming from? Spinal stiffness.
Yeah. But I always, and whenever I see that now, and I think,
yes,
hopefully people will understand this. The dog knows that they have not got the strength, the coordination to lower themselves gently, and they need to get from standing to laying so badly that they're willing to drop themselves.
Absolutely.
And that is going to create a hell of a lot of discomfort, that action alone. And when you sit there thinking, crikey, their life, that's not a nice place. If I do it, it's going to hurt. If I don't do it, I'm going to hurt. Oh, okay. And when you have owners come in and say, oh, yeah, he's been doing that for ages, like,
I know. It makes you want to cringe. But here's the thing, too, is I'm not going to take that dog just because it has a loss of strength in those quadriceps, right? So that's the muscles in the back legs that kind of can gently lower the dog to the floor. I'm not going to go put that geriatric in an underwater treadmill and strengthen.
No.
They're going to move, right? They have to. They don't want to die. They don't want to drown. But people want to strengthen.
Yeah.
It's not a strength issue. It's a mobility issue.
So let's let you do your soapbox now. So it's a totally appropriate moment now.
Okay, perfect.
And I'm just going to precede it with, it's a developing area. There's a lot of people doing great work. There's a lot of people trying their hardest. There's people that are getting onto the rehab bandwagon. They've got different levels of experience. We're not pointing fingers at anybody. We're not telling people off. But you're allowed, with all of your experience over the years of doing this, to give people some advice. So you're not telling people off. You're sharing your knowledge. But what is something that you see frequently happening with owners and clinicians that have the best intentions? Go for it.
In pretty much what I just talked about. Everybody wants to strengthen, and I'm a big motor control girl. So let's just go back to that older dog. When you age, you lose muscle. Sarcopenia is the big fancy word for muscle loss, and that's also why over time people get shorter. So we lose muscle, we start to lose just space between your vertebrae all the way down our spine. We get shorter, we lose muscle, we get weaker. Dogs do the same because they are living older. But where is that coming from? It's not just disuse atrophy, it's neurogenic atrophy. And that's really just a big fancy word. There's a disconnect from that nerve to muscle. And if that nerve is not firing right, that muscle doesn't maintain the tone and it weakens. You can't strengthen that. That's the key take home at this point. You can't strengthen if there's a neurologic or a neurogenic type of disconnect. So understanding where this is coming from, and oftentimes we start to see atrophy along the spine. So now those vertebrae look like little stegosaurus, and there's a lot more indentation, if you will, along the spine, so it looks more prominent. And that's also neurogenic, muscle atrophy. So now there's no stabilizers. There's nothing really to stabilize that spine. Yeah. So we have to have those superficial muscles that help to stabilize. And those are the big ones that pretty much right on the side of the dog. They say it looks fat, but it's really hypertrophy and muscle development of some of those superficial muscles to help stabilize that spine and all those vertebrae. So here again, strength is really not the key. You have to have flexibility. You have to have range of motion. And perhaps strengthening at that stage is static. Maybe it's not forced exercise in an underwater treadmill. Yeah. Maybe it's flexibility exercises, and of course core. Everybody talks about core as well. But understand the difference of strengthening and why you're strengthening, in addition to neurologic or neurogenic types of action.
Yeah, and I think whenever you do anything like academically, like we're doing, we're trying to talk about something. We kind of categorize things. This is a strengthening exercise. This is a neuromotor control exercise. This is actually, a lot of the exercises that we ask people to do with their dogs do multiple things. What you're trying to say is don't go hell for leather in it. So
right.
Yeah, and also look at the dog, what they are achieving comfortably, and take them a little, challenge them, don't force them, I think is probably what you're saying.
Yes.
And that there's going to be a number of people that are watching this and their dog does go to maybe hydro, it does have underwater treadmill, and they're now panicking.
Thinking, no, I don't mean.
So let's just kind of, we're not saying don't do it. We're just saying keep it in moderation. So
yes.
How would you tell an owner to be able to identify what is the appropriate level?
Great.
Do you see what I'm trying to say?
Yes, absolutely. Great question. And what I go back to is normal daily activities. Really, that's what it is. And modification of those normal daily activities. Right. So instead of going to hike, we're Colorado dogs. We love the mountains. We get out there and hike 5 miles. Well, or just a walk around the block. How do we identify fatigue? And that's one big thing that I think our field is lacking. How do we understand? Now it's obvious if you're walking your dog around the block and your dog is way back here, right? So, or they sit down. How often have you heard, hey, my dog sits down and he won't go, he won't budge. That tells me there's a major problem. But are there subtle things that we can identify that may help us say, if we know the dog has arthritis, what I always recommend is short, frequent activity. Yeah. It's short, frequent walk. Rather than one hour walk in the morning or in the evening, maybe we split it into 2 or 3 15 to 20 minute walks throughout the day. Yeah. So being able to understand the problem, identify it, touch it, feel it, modify it, that's really kind of the handout that I work with my clients on.
So what about in the context, because as you say, there is, I'm not going to pick on the lady, I can't remember exactly where she was, but somebody said, my dog's got this, he's on that, hydrotherapy or physiotherapy. And there's, in people's head, there's a pick one and go for it. So say we've got a number of people that are pursuing, say, hydrotherapy, and they're now a little bit panicked that they're pushing their dog too hard. Talk about the sort of signs that you would be acting upon
Yeah.
in a hydrotherapy concept,
Yeah, that's a great
or in a
question too.
physiotherapy setting?
Yeah.
Because I really want people to employ the use of, the services of therapists, physiotherapists, hydrotherapists. I think what they
For
bring
sure.
to the table is incredible.
Yeah.
But as you say, there are a lot of people out there that are taking them to these therapists expecting great things, and the therapists are expecting great things,
Yeah.
and the dog's going, no.
Get me out of here. Get me
Yes,
out of here.
give us some indicators.
Yeah,
that
and for
you
sure,
really
I
do.
I have one. I use my treadmill. I absolutely love it. I'm not, downplaying that at all. And I think, again, as a profession, we have to be able to identify how much is enough, or when enough is enough. Um, the one of the keys that I use is the dog's behavior,
Yes.
in the water. I'm not going to change this disease. You're not going to change this disease. Any modality that's out there is not going to change the course of the disease.
Yeah.
So to find that moderation, number one, the biggest key that I have, hey Hannah, how was your dog after the last session?
Yeah.
That's the only verbal communication that I have to help me understand how your dog tolerated that last hydrotherapy session.
Yeah.
Was he sore? Was he limping around? You know, was he more spry and bouncing around for a couple days after, and then he got
Yeah.
tired again? And
So you
not
really,
only
that's a key thing though, because hydrotherapy is normally done maybe once a week, twice a week. If someone's really motivated, might be even once a month. The therapist needs to be making notes of what that
for
dog
sure.
did, so that if the owner comes back and says, actually, he was quite stiff that evening and quite slow the next day, that therapist can go, what did I do before so that I can now adapt as well as use my observations? So I did a lot of secret shopping with Holly. Just everybody knows I'm quite manipulative and obsessed. And I went to quite a few hydrotherapy places where I was living, and I didn't tell them what I did, and I just wanted to see what their activity, what their approach was. And there was a few that didn't ask for consent forms. There was a few that didn't kind of like really make notes. So just be vigilant, guys. We're giving you all this advice of how to make it safe and appropriate. Look at what your therapist is doing as well with the same intention. And if you're not seeing that, have a little bit of a red flag. That's all I'd say.
Well, it for sure, I would agree with that. And as PTs, as veterinarians, we have to document. That's all part of the legal, part of our profession. We have to be able to document. Now, the other thing that I would encourage is, for sure, behavior. Is the dog trying to turn around? Is the dog trying to sit down?
Yeah.
Has he changed his stride? Has he changed his gait in the water? And that's an indicator for me that, okay, maybe I need to stop here. And are you forcing that shortened stride? Are you forcing, speed and duration are the two controls that we really have, in a treadmill. Maybe instead of one 5-minute walk, one 10-minute walk at a certain speed, we drop it down into 2 5-minute walks instead of 1 10. Do we increase the speed? Do we decrease the speed based on what that gait looks like in the water? Are they coming off of that limb a lot faster? Because here again, we're forcing them to do it. They're going to do it. They have to, or they're going to bump their butt on the back of the treadmill. So how do we adjust those parameters to, number one, get the outcome that we want, which is the communication with the client, but also to see what their gait looks like and to improve their gait.
Yeah.
So those are the big things that I see. Yeah.
So let's quickly, because I can see me and you can talk forever. And we're already halfway. And I've got to get a cab to the airport.
You need to get home. No, just come to Colorado.
Yeah. Otherwise I'll be in Atlanta for a bit longer. So my next thing was your feelings about diagnosing, treating young versus old. There's something happening downstairs. How do you find managing owners of younger dogs compared to older dogs? And we'll just tap into this for just a few minutes.
Yeah.
And the reason I'm doing this is I want people to be aware of who they are with their dog going to see therapists. It's a bit of a tough time at the moment in the vet sector. We're losing people left, right, and centre. And a lot of people find client communication quite difficult, and they do their very best on their side of the table, but what they get back can be quite difficult. So this is my little opportunity to try and get somebody else's advice for you owners to be that perfect person to communicate with, to get this amazing information across. Do you find you have a difference between young and old owners, etc.?
Well, and I want to take one step back from that. Don't expect that kind of conversation from your general practitioner veterinarian or your specialist veterinarian. That find your rehab vet, find your physical therapist, find your rehab practitioner, because this stuff takes time. You're not going to get this information in a 15-minute general practitioner appointment. And again, nothing against them. They have to talk to you about all the medical stuff. So find yourself a rehab practitioner that can talk through it. And probably the biggest difference that I see, so we'll start with geriatrics. By the time I see the older dogs, they really see the decline. They really, put their heart and soul into fix my dog.
Yeah.
And that's where we have to have that honest discussion of, look, I can help. Again, we're not behind. We can still help. We can still improve mobility. We're a little bit behind the eight ball. Had we started 5 or 10 years ago, could we have a different outcome? And I don't know that. We need to figure all of that out. They're way more invested because they see how much more their dog is struggling by the time they're 10, 11, 12 years old.
Yeah. And I tend to find a lot of my owners will want to try a bit of everything.
Absolutely. Exactly.
We've got a lovely client base where I am, and you'll find that the owners will engage with the pharmaceuticals, the supplements, the weight loss, the home modifications. They'll go with the physiotherapy. They're more than happy to drive to the hydrotherapy. Yep. I just wish I could grab that real wish and bring it forward 5 years.
Right. Exactly. And that's, I think that's the younger dogs are harder to convince clients because they don't see what this looks like 5, 10 years later. Yeah, they see a little bit of a problem, but you know what? Maybe I modify the activity, I put them on an NSAID, and they're fine. And we can still go do our fun things. But understanding the pathophysiology, the underlying just cycle of breakdown, inflammation, pain, it resolves when the dog rests. Breakdown, inflammation, pain, it resolves, as the dog is rested. Even during the week, you're at work and the dog is laying at home. You go out, you're a weekend warrior, the dog limps, rests. Again, that is building upon itself. That we as younger dog owners don't really pay as close attention to, if you will.
No, and I think there's also, and I totally understand this, and I know if I didn't know what I know now, there's this real wish for the dog to have the life that you wanted it to have. So I have always got that conversation with owners where they wanted to hike, they wanted to throw the ball, because that's what their concept of the bond would be. Their bond with their dog would be the dog walking up the stairs with them to bed, the dog jumping in the back of the car and going, let's go, so that they've got this expectation, and I'm there going, we're going to have to change it. Yeah. And I can totally understand people not wanting to engage with that. But then, as I say, I wish I could give them a crystal ball and go, these simple changes that you're going to get used to quite quickly are going to have a profound effect in a few years' time. So, yeah, lifting your dog into the car or having a ramp, at the time where you're changing your behavior, your routine feels like, oh my God, what's this about? This is so annoying. Mm-hmm. She's added like 2 minutes to every car journey I go on. But if only they could have a snippet of how quickly they'll get used to doing it, how it'll become a routine. They won't even think about it in a few months' time, but the impact it will have later is huge.
Love it.
Have I explained that okay?
Yeah, I completely agree. It's even hard for us to say, if you do these exercises, if you do this whole laundry list of weight loss, of an NSAID, of a nutraceutical, of home modification, of exercise X, Y, and Z, we're going to change what that looks like 5 and 10 years down the road. We really don't know. We really don't know. There's speculation based on what we know from the human world, right? Yeah. Move it or lose it.
Yeah.
We do know that. We do know there's so much more data on the human end of understanding arthritis and understanding what altered gait looks like down the road and the effects of altered gait. Because pain alters mobility. There's
Yeah.
pain there, and even more so, dogs with 3 additional legs are going to alter their gait. We just don't know what that looks like down the
Yeah.
road.
And it is
It's hard to tell. It's hard to
I
tell
kind
time.
of liken it to a bit like a spider's web. You know, when you put your finger through a spider's web and it all kind of starts congealing down, and you keep pulling your finger through, and it can. If you can actually take your finger and go back before you congeal it down, you keep the tissues moving well, don't you? But over time, if you don't acknowledge these adaptations, they do progress. I've got somebody arrived. Guess who that is?
Evie, hello,
Evie.
Evie.
Let's do a couple of questions, and
Yes.
then we're going to do a couple of cases. But I need to finish at
Yes, you need to go.
3.
Don't miss your flight, Han.
Oh, I missed one. Let's go up the list. So Barbara says, "What's your opinion of having physiotherapy for fitness?"
Ooh, I
I know
love
what
it.
the answer's going to be.
Love it. Love it. Love it. Love that. Love the question. The key with this for me is the still an evaluation in understanding structure and function. Here again, just because it doesn't currently have any orthopedic issues, are there changes in soft tissue? Are there changes in range? Is there discomfort on palpation, trigger points, fascial restrictions? Soft tissue is probably more important. Don't tell the orthopedic surgeons I said that, but what moves bone?
Yeah.
Muscle, soft tissue, right? So before it becomes an orthopedic issue, can we identify some of these soft tissue changes? And I'm all about fitness. I have 6 hunting dogs. We just
6
lost,
at the moment.
yeah, we just lost Pearl last week. We're down to 5, but we have hunting dogs. If you saw my 15-and-a-half-year-old, you would be aghast that his mother is even a physical therapist. He is the most dilapidated, this dog will still walk to the barn and back. He's phenomenal. And the fact that he still moves is probably why this dog is still alive.
Yeah.
So, but I think it's really important to continue to evaluate the dogs with, changes in soft tissue, changes in some of the range, change in the way they move.
Yeah.
But I am all about fitness. I just struggle with this whole forced exercise.
Yeah.
Do we road them off of a 4-wheeler? What is appropriate types of strengthening activity, resistance training? And we could get into all of that with, physeal, puppy. Oh, that's a whole nother discussion.
We can do that again.
Yeah, we can certainly do that again.
To add a veterinary perspective to what you're saying about fitness, physiotherapy assessment early in life when there's not a perceived problem.
Mm-hmm.
We vets do it every single day. We check the heart, we check the chest, we palpate the abdomen, we take temperatures. We're checking systems.
Yeah.
But what we don't tend to do is check the musculoskeletal system. And that's a little bit sad, but I'm hoping people kind of go, we've got the cardiovascular system, we've got the respiratory system, we've got the urinary tract system. We've got systems that we're already checking. Let's just add one to it and make it normal that you do those checkovers. Right, next question.
And sorry, I'm laughing. I just have to take a step back. I'm laughing because all of those systems you said, and I'm like, I don't do that. I'm not looking at the heart. I don't listen to the lens. So I'm like, that's you guys.
I know, pets are amazing. They do a lot. Okay, so this is a good one. Do you find any clinical benefit from fortitropin supplements? So this is the big player on the market. It's quite a newbie. There's a lot of marketing going on. There's a lot of people, talking about it.
I'm going to leave that one to you, Hannah. I personally have not delved into the literature to answer that one way or the other. I typically, as a human physical therapist, I leave a lot of the nutraceuticals, a lot of supplements, of course, prescription medications, up to the veterinarian. I just have not personally gotten into that realm. And it's the same with a lot of the, other supplements that are out on the market. I feel like if I'm going to prescribe it, I need to do my own due diligence to understand it, learn it, and believe in it one way or the other. if I'm going to sell it to you. And to
Absolutely
me, it's
agree.
a whole new, it's a whole different world. It's like nutrition, right? And I leave that to you
No,
guys.
it's fair.
I
I
do.
think I think everybody that is wanting to engage with supplements have got to remember that the actual evidence behind them are very weak. And I was really privileged to just listen to Steve Budsberg, who is a really eminent vet in evidence-based medicine, do a talk at this conference. And the message is clear: we have poor evidence in the vet sector. And just because something's got a number of references underneath, check them. It might be related to something done in 1965 on rats. It might be a translational study in humans. So do check references. With regards to this, it's a good company. They put out good education. There is a little bit of evidence behind it, but they're not big studies. And have you got the money to do it? And if you haven't got the money to do it, and something else is going to suffer, so your visit to the physiotherapist, your ability to put rugs down, all of these, your visit to the vet to afford your pharmaceuticals, if that's going to suffer, then for me it's not worth it. Look at what your core is. Can you afford it? Then fine. So yes, this one. What's this one? Oh no, that was just a nice one. That was people talking about what they're up to. Oh, people talking about the age of their dogs. Love it. Please join in. It's nice. Here we go. This is the one.
Love it.
So there is this kind of forced
Mhm.
choice that we have especially over here in the UK. We don't have centres that will offer hydro and physio and massage and laser. The normal structure here in the UK is the vet is a standalone, and then the therapist is a standalone, and there's crosstalk, but you always have to choose who you want to go and see.
Hmm.
And that makes it very difficult. Whereas over in America, you have them condensed into centres where there isn't necessarily a choice that needs to be made. You do what the dog needs at that day. Does that
Right.
make sense? So,
Absolutely. Yeah.
but in this situation, I think I'm going to butt in just because I want to get onto a couple of cases. I think it would be always nice if you can see a physio, just because they're going to have a more broader understanding. They've got longer level of training than the standard hydrotherapist, and they would be able to guide you. All the physiotherapists that I work with, if they feel hydrotherapy is appropriate, they'll get you into hydrotherapy, but they're a really good connecting point. So that's what
Yeah,
I would
I
advise.
would agree with that too. And start with a evaluation, a physio eval, a rehab eval, plus or minus hydro if it's deemed appropriate. Because oftentimes too, remember that when a dog is 13, there tends to be perhaps some neurologic issues as well, which could actually make the dog worse if hydrotherapy is performed. So it's important to rule all of that out.
Perfect. This one is a lovely one. Here we go. It's so hard to manage a dog with anxiety. My English Springer Spaniel, only 4, really tough to make all the recommended adaptations, also meet his anxiety needs. Any advice? Is that just balancing the two conditions? We've worked with a behaviourist and a vet, a physio and a hydro on board. Battle on,
Mm.
love. Battle on. I would say, I don't know who your behaviourist is, but a clinical behaviourist would be able to look at it from a very veterinary perspective in the form of pharmaceuticals and nutraceuticals that might help. Um, there's definitely a lot more thought towards utilizing pharmaceuticals to help with anxiety, to open their learning processes, their memory, their confidence to do the activities that you need them to do to gain. So do check in with your vet and just see whether, I'm not saying your behaviourist is bad. I'm not saying that the majority of behaviourists would not be able to recommend that. So that would be a bit of a tip I'd give. What about you, Carrie?
Yeah, that's a tough one. Again, I probably with behavior, I do think activity is important. It just depends on the dog and understanding where that anxiety is coming from, and that's probably one I would consult with a veterinarian or behaviorist on for the most appropriate exercise activities. And maybe hydro makes it worse. I don't know if that dog's petrified of water. Not all dogs swim. Not all dogs enjoy the underwater treadmill. So I think that's something to work with the veterinarian to understand what exercises can alleviate the anxiety, but not feed into it.
Amazing. Ruth, you get top blinking marks because you're absolutely right. We did have a whole tea and chat on it, so well done for you for remembering. Tracy, so I'm going to quickly do this one because we've got a lovely and incredible specialist joining us soon to talk about the drug known as Librela, which is Bedinvetmab. She will not be giving opinions about adverse events and off-license dosing, but she is going to be talking about the mechanisms of how this medication works and the science behind it, and that's coming later in April. As a first opinion vet, it's very difficult to advise you. We have strict rules. However, I will say in my experience of using Librela on quite a wide population, I'm having good results. Not every dog responds, but the ones that do, I tend to see it within the first 2 to 3 injections. I seem to, it's a window of opportunity to get everything else in place as well. It's not the be all and end all, but have a chat with your vet. Okay, because we've only got 15 minutes, let's do a case, okay? Right, I gave you a couple of imaginary cases. And I'm going to go number 9 because this is about young and old. Imaginary case, a 9-month-old golden retriever with hip dysplasia. So it's been confirmed with radiographs. But the dog has got super difficult behavior, strange gait, has started to chew itself, licking around its hips, lower lumbar area, and has already started to hate going to the vet. We're not going into great depth. We're trying to do no more than about 3 to 5 minutes, just so that we cover a few cases. But what kind of things spring to mind with that in your line of work?
Well, I'd rule anything neurologic out first and foremost with the chewing. That makes me a little bit nervous. That is there some neurogenic sharpshooting pain that's coming from nerve root signature? That's not just orthopedic. So that's the first thing that stood out. I'm cheating. I have the case in front of me, so I remember everything you have. So the other considerations is if this dog is hating the vet. I had a separate facility. I wasn't part of the vet hospital, which sometimes helps to alleviate the anxiety. I wear scrubs, I smell like the vet. And just putting this patient, I've actually evaluated dogs on the sidewalk. So we'll go outside in the nice weather. It's snowing today, but we'll go sit on the sidewalk. We'll sit in the front lobby. If that exam room is too scary, and then the first meeting, I'm going to ignore it. I'm just going to ignore your dog. I'm going to sit down. I'm going to have a chat with the owner and let that dog come to me and get comfortable. And perhaps I don't complete my entire evaluation on that first visit because I don't want to cause pain. I don't want to push that dog away from me even further. I have to get my hands on it. So maybe we do some gentle palpations. And I can tell you, most of these dogs understand over time that we're there to help them, and we're not going to poke and prod and hurt and crank and force. And my big thing is hands-on, soft tissue, and looking at that range of motion and trying to identify where the muscle spasm or muscle compensatory discomfort is. And maybe it's weakness, maybe it's favoring that left hip. Is it left or right now? I can't remember.
It's bilateral.
Yeah, okay. So favoring one side or the other, which then forces spinal stiffness. So I'm going to target that. And I may not increase range 100%, but I'm going to improve gait. I'm going to get them out of that tuck posture. I'm going to apply more hands-on soft tissue techniques to improve mobility. But that said, first and foremost is pain management. I'm not going to do any of that until that dog is out of pain. And I have shipped dogs back.
Yes.
And whether that's you, whether that's me, that's a combination of medication, which most likely it typically is. I have not just modalities. These are my modalities. This is what can help alleviate some of that soft tissue pain. It's just feeling, touching, palpating, treating with soft tissue techniques to improve that mobility, whether it's trigger points, whether it's improved spinal mobility. This is my key right here.
Yeah, absolutely. Yeah. And I think we've just proved that having a team approach is really important.
Amen,
but this dog to me is saying, I ain't coping. I don't want you to do stuff to me because I still hurt.
Yeah.
And we have to always make sure that pain control is paramount, because you're not going to get the best of anything after that.
You bet.
So,
And you're
yeah,
going to get compensation. If that dog is still in pain, you're going to get compensation. And pain feeds into
yeah,
abnormal motion,
yeah.
abnormal gait.
So the owner needs to have expectations. It's going to be go slow. You're not going to
Yeah.
see sudden changes. You're probably going to have to bring in some kind of learning component once pain is under control, once the therapy is starting to work. Those behaviors are going to be learnt. That's what keeps us alive. If something hurts, we don't do it. So we have certain behavior patterns to avoid it happening again. We don't just forget that when the pain goes. So
Yeah.
hold on tight to that person. You've got a lot of work ahead of you. Right.
Anticipation. It's anticipation of pain too. They remember, and they're like, "Who are you? You're going to touch me on that hip? I know it's going to hurt, and I'm going to bite you. I'm going to nail you because
Yeah.
I expect that area to be painful."
Yeah, exactly.
Yeah.
Exactly. Right. Quick question, and then we'll do one more case. Is it advisable to buy a small infrared light machine for my old dog? These are such big questions. I'm going to butt in quickly and then let you.
Yep.
When we advise, we've not seen your dog, we don't know your circumstances, we don't know your dog's comorbidities. So it's always very difficult to help people with such direct questions. Um, I just wanted to place that there. Carrie,
Please.
what
Yeah.
do you think about these readily available online?
Yeah. Yeah. And I'm with Hannah too, because what if your patient has some sort of underlying cancer where light is contraindicated? So, to say for your specific dog you should do XYZ is not an appropriate form of advice for us. But in general, when we talk about light, we talk about laser therapy. I I would encourage you to understand the wavelength. I would encourage you to understand the manufacturer. For sure, some of these are super beneficial, but some of them are just literally like taking a laser pen. It's going to do squat, and people will sell you anything. Unfortunately, that's the internet, right?
Yeah,
So do
they
your
can be
due
very
diligence.
pricey.
Yeah, for sure. Do your due diligence, talk to a clinician, and understand what the underlying wavelength and format is for that particular
Yeah.
laser.
And my additional commentary. So when I started CAM, and I realised all of these therapies existed, and I didn't know about them, and I'm still learning every
Sure,
day.
we all are.
At this conference, there was an exhibitor suite. There are so many new things coming to market, and they're all mild variations on something else. And I just was like, I'm never going to get my head around this. There's no way in the world. So my solution is, if you can afford it without the detriment to any other evidence-based intervention, if your dog tolerates it and it's not ruining your bond, so you're not forcing pills down and pinning them down and doing things that they don't want to, then by all means, as long as it has no potential for damage, but then check in. Is it even bloody working? So with something like that, I would be imagining that you would want to be doing it on almost a daily basis to get any desired effect. You'd put a time on it of maybe 2 to 4 weeks, and then you'd assess, has it actually changed anything? Because if
Yeah.
it hasn't, you're wasting your time and your money.
Yeah.
Fair
And,
way?
and follow manufacturer recommendations. Maybe daily is too much.
Yeah.
Can you burn the patient? Some of these lasers out there are not safe. So really make sure you understand what you're getting yourself into.
Perfect. Okay, one more, and then I'm going to say goodbye and run for my Uber. I always cut it really fine.
I
Evie's
love
probably wetting herself at the moment. Okay, so we got imaginary case number 2. It's a 12-year-old spaniel, gross remodeling, poor range of motion, bony end point, but no effusion in bilateral elbows, both elbows, but super happy, still trying to chase birds, but licks forelimbs in the evening.
Love it, love it. There's your pain, right? So licking, there's your pain. And we're just going to start there with pain management. And again, how do you know? Licking is a great sign for pain. Um, also, if you saw Loomis, he limps all the time. But I can tell you, if you throw the ball in his little dilapidated way, he goes and chases it. Now, do we throw it across the yard? No, we roll it 3 feet in front of him. there's your home modification, right? We want him to move. We want him to be happy, have an amazing life. But it's all about modification. Are we going to force him to go for a walk around the block? Probably not. Let's assess his range of motion. Let's look at joint mobilization to improve some of the range, so perhaps he can, move a little bit easier. So there's a lot of ways. Of course, soft tissue. I've probably talked enough about soft tissue, but in a 13-year-old with this severe amount of arthritis, I guarantee there's soft tissue differences. There's compensation. He's shifting his weight in different directions, causing breakdown of other parts of his body that need to be identified and addressed. Again, we're not going to change the primary pathology, but we are going to alleviate pain and improve mobility through addressing some of these compensations as well. So it all kind of goes hand in hand. And to make his life the happiest that he can be and to be able to move as easily as possible, that's my goal.
Yeah, absolutely. And I think I'm really lucky. I work with a lovely physio called Tanya, and the way that she writes her case notes is always clarifying what her intentions are. And it's always quite broad statements of, improving range of motion, improving independent mobility, improving pain control. And I love that because every day it makes you think, what am I doing with that in mind? What am I doing with that in mind? So, perfect answer.
And that's a great point too. If it's not working, change it. Maybe we need to modify it. And there's where the communication comes in again. Whether it's hydrotherapy, whatever modality, hands-on, whatever treatment you're providing, there has to be that give and take and that discussion. He's worse, he's better. How do we modify? In every single treatment, we will do that every time.
Yeah, perfect. Yeah. Quick questions. I hate anybody not having their questions answered. If they've taken the time to come and join us, I certainly try and answer questions. So this will be a homeopathic remedy, I should imagine. It rings a little bit of a bell. I'm not a homeopath, but I think my friend used it on her cat, if I remember, but I might stand corrected. With regards to things like homeopathy, the science behind it is very alien to Western-based scientists. We look at the science and it doesn't compute. With that in mind, the guidance from the Royal Vet College now is that it can certainly be added to a plan, but it should never replace a plan. So when you've got something that has less strong evidence, then you choose something that has got strong evidence first, you add the other, and if it's going to work, then you can come off the original. But going straight for that, if it is what I think it is possibly leaving your dog vulnerable. Is that a fair answer?
Yeah, I've never heard of that. Again, I kind of defer the nutraceuticals, all the homeopathy back to the referring veterinarian, because they can also have adverse effects with some of the Western medications that have been prescribed. And I don't know that we know enough about that. So I personally stay out of that and leave that to the veterinarian.
Yeah, it's really tough. Like whenever I have to do anything about, for example, supplements, I cry a little bit. I lock myself in a cupboard for a few days, and then I force myself to sit down and crack on with it. But it's really tough.
And that's where I say, it's all yours, Hannah. It's the beauty of a PT.
I hate it.
It's all yours. Yeah.
So I'm going to have to run, guys. Otherwise, I might stay here in America. My boss won't be happy.
Come to Colorado.
Come to Colorado. Carrie, it's lovely. It is absolutely lovely. And I'm going to drag Evie over to see you. We'll come and hang out.
We'd love that. We'll see you in September. Thank you guys so much for the opportunity.
Thank you. And everybody, please say thank you to Carrie for giving up her time. Absolutely wonderful to spend time with you.
Always.
But until next week, or is it later this week? I can't remember. Evie will tell us. It's really great that you can join us. Please continue to join us, and we will see you soon. Bye.
Thank you. Safe travels.